Hi there, my name is Brianna and I am a health equity scholar. I first wanted to say thank you for anyone that is taking some time out of their day to be here. This summer I worked with Dr. Margarita Teran and one of her PhD students, Dawson. This summer I conducted a literature review on why hypertension rates were lower amongst African immigrants upon arrival in the United States compared to African Americans. So before I dive deep into it, let's take a look at the three main talking points I will cover in this video. My first talking point is going to be on the background of food and lifestyle of the Nigerian and Congolese communities. This will give you a better understanding of what some of their traditional dishes are and what their lifestyle is like. The second talking point will be the health conditions of African immigrants upon arrival in the United States and comparing this to their health status after living in the United States for 5+ years. And last but not least, my third talking point is going to be on what is causing their health to deteriorate over time. Take a look at the background of food and lifestyle of the Nigerian and Congolese communities. The following images are traditional dishes that are common amongst the Nigerian community. The first photo we have here is fufu. It is a staple of African dishes and is typically a root that is boiled and mashed that provides potassium to their diet. Some examples would include cassava and taro. Another common dish is moin moin, which is steamed bean pudding made from a mixture of washed and peeled black-eyed peas, onions, and fresh ground peppers. This dish is full of protein and is yet another staple. The following images are traditional dishes that are common amongst the Congolese communities. The first photo we see here is saka saka or pandu, which is a dish derived from cassava and is an essential source of protein, calcium, and vitamins A and C. And then next here we have mwambe chicken, which is also known as palm butter. My next talking point is on the health conditions of African immigrants upon arrival in the United States, and comparing this to their health status after living in the United States for 5+ years. As you can see from the previous talking point, African dishes provide a lot of nutrients, which can explain why a lot of African immigrants are in healthy condition upon arrival to the United States. But as their length of stay increases, their overall health starts to deteriorate. A study of attitudes about hypertension among Ghanaian immigrants in the Netherlands revealed that hypertension was often construed as part of the stress of migration. This is most likely what African immigrants arriving in America experience as well. Although African immigrants arrive in the United States with some unique health problems, they are generally healthier than African Americans of the same age and appear to suffer from lower rates of hypertension. What is exactly causing their health to deteriorate over time? A common thing amongst most African immigrants is that they had a hard time locating their traditional African vegetables, and according to Oxford and Zahn, there is an increase in consumption of fast foods such as pizza and breakfast cereals, which are very high in carbs and sugar. Another thing that could factor in health deteriorating is that African immigrants tend to find the life in the United States to be more demanding, where most immigrants have at least 2 jobs to make ends meet. This means that they have less time to cook nutritious meals and puts them in a position to order out more often. We observe that the health of African immigrants is in a lot better condition than African Americans due to the natural and clean foods they often consume back in their origin country. From the literature review I conducted when taking a closer look, I started to notice a decrease in the amounts of fruits and vegetables African immigrants consumed and an increase in fast foods. The increase in sodium and stress due to migration are just 2 out of the many reasons why we see a rise in hypertension amongst African immigrants as time goes on. This literature review is the start of something small, working towards creating something bigger like educational materials and fitness programs to help underserved populations towards a healthier life. With that being said, this concludes my presentation. Thank you so much for your time and attention. Are there any questions?